Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at Mercola.com for the latest health insights.
Have you ever wondered whether the pill you take to strengthen your bones could quietly weaken your jaw instead? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and with me is Alara Sky. Today we're exploring the hidden connection between popular bone medications and a painful condition known as medication-related osteonecrosis of the jaw, or MRONJ.
Thanks, Ethan. MRONJ occurs when sections of your jawbone die and refuse to heal. According to a Finnish study that tracked more than 58,000 adults, the risk of developing this condition jumps dramatically when you take certain anti-resorptive drugs, especially Denosumab.
Let's set the stage with the numbers. Researchers found that people on Denosumab were 5 times more likely to develop MRONJ than those using Bisphosphonates. That risk rose even higher for cancer patients and for anyone who stayed on the drugs longer than 5 years.
The study also showed that adding corticosteroids multiplied the danger. For some users, combining steroids with low-dose bone drugs increased MRONJ risk 6-fold. In high-dose regimens, the combination still doubled the threat.
You might be wondering why your jaw is so vulnerable. Unlike other bones, your jaw experiences constant micro-injuries from chewing and brushing, yet it has a limited blood supply. When a medication blocks normal bone turnover, those small injuries can spiral into non-healing lesions.
Exactly. Denosumab almost eliminates osteoclast activity, cells you need to remove damaged bone. Without that cleanup crew, the jaw can't repair routine wear or infections. Bisphosphonates impair healing too, but they accumulate more slowly, so the breakdown tends to appear later.
Delivery method matters as well. The Finnish data showed that intravenous or subcutaneous dosing caused more harm than pills. Shots and IV infusions push the drug straight into your system, interfering with bone remodeling more aggressively.
Another danger zone appears when you switch from bisphosphonates to Denosumab. The study revealed that making that switch more than doubled MRONJ risk among low-dose users, stacking drugs designed to halt bone breakdown compounds the damage.
Let's talk triggers. Over half of MRONJ cases begin after tooth extractions, but the condition can start without any dental procedure at all. Gum disease, ill-fitting dentures, or even routine chewing can expose bone that refuses to heal under these medications.
That's why preventive dental care is crucial. Before starting an anti-resorptive drug, especially through IV, you need a full oral exam and any infections resolved. Once therapy starts, schedule cleanings every 4 to 6 months so problems are caught early.
Jaw pain that lingers, loose teeth, or visible bone in your mouth should raise immediate concern. Those aren't just dental annoyances. They're warning signs that your healing ability is compromised. Ignoring them can lead to chronic pain, infection, and fractures.
Now, many listeners were prescribed these drugs for osteoporosis. If that's you, remember that long-term use accelerates risk. The Finnish study showed a noticeable spike after 5 continuous years, especially at higher doses.
Cancer patients face even steeper odds. High-dose regimens aimed at controlling bone metastases produce faster, more severe MRONJ. Male cancer patients, particularly those with prostate cancer, had the worst outcomes in the cohort.
Beyond medication, several amplifiers worsen the picture: vitamin D deficiency, chronic oral inflammation, immune suppression from chemotherapy, and poor hygiene habits. Each one chips away at your capacity to repair bone.
If you're feeling uneasy about your prescription right now, you're not alone. Dr. Mercola urges you to rethink bone drugs that shut down natural repair. He emphasizes that the microcracks created by suppressed turnover leave bones more brittle over time.
Instead of jumping straight to a DEXA scan, consider radiofrequency echographic multispectrometry, or REMS. This ultrasound-based technology evaluates bone strength without exposing you to ionizing radiation and offers a clearer picture of fracture risk.
Once you know your baseline, nutrition becomes your first line of defense. Optimize vitamin D production with sensible sun exposure, and support it with vitamins K1 and K2, magnesium, calcium, and collagen. These nutrients work together to rebuild resilient bone.
Collagen often gets overlooked, yet it forms the flexible framework where minerals lock in. Pastured bone broth, grass-fed gelatin, or targeted collagen supplements can supply what your bones need to stay sturdy.
Movement is another pillar. If heavy lifting feels out of reach, blood flow restriction training offers a safe alternative. By briefly limiting venous return during light exercise, you stimulate growth factors in muscle and bone without high mechanical loads.
Daily habits reinforce those gains. Walk regularly, avoid processed foods, skip vegetable oils high in linoleic acid, and choose mineral-rich whole foods. Leafy greens, fermented dairy, and slow-simmered broth deliver magnesium and calcium in a balanced package.
For listeners already on anti-resorptive therapy, talk with your clinician before making any changes, but know that stopping long-term use may allow your jaw to recover its natural turnover. Transition gradually and pair it with nutrient support.
If you require dental work while on these medications, coordinate closely with both your dentist and prescribing doctor. Pre-procedure assessments, antibiotic protocols, and healing windows can lower MRONJ risk, but timing is everything.
Remember, once MRONJ sets in, reversal is difficult. Advanced cases may need partial jawbone removal. Prevention, through informed choices and proactive care, offers your strongest shield.
Let's summarize the essentials you can act on today. Know your true fracture risk with REMS, fortify your diet with key micronutrients and collagen, train safely with blood flow restriction or weight-bearing movement, and maintain strict oral hygiene.
That brings us to your challenge. This week, schedule a comprehensive dental checkup and review any bone medications you're taking with your provider. Use that appointment to discuss nutrient strategies and ask whether REMS scanning is available near you.
Taking those steps puts you in control of your jaw health and your overall bone resilience. You deserve therapies that strengthen, rather than silently sabotage your ability to heal.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.